Finish my smoothie.
Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this week's cross-industry update with Boulder County Public Health. As always, put your questions in the Q&A feature, not the chat. We use the chat to push out information to you and links that are important. Ask your questions. I'll ask them on your behalf. But in the meantime, let's just get started with Jesse and your updates.
Thanks, Corinne. I'll jump right in. So we'll start, as we do each week, with the epidemiological update, go over our state dial status, and then get into public health order updates, and then we can take your questions. So just wanted to put out, a number of ways of looking at where we are right now. And this is a day-by-day count of newly reported positive tests. And you can see, a couple things I think jump out. First of all, we are well above where we were this summer, where we were after the CU outbreak in terms of daily case counts. But also, I think it's important to note that this was not like the CU outbreak where we had one significant spike over a very short period of time. This is elevated across a period of time. And so it's a longer term trend that's going to have a longer term impact on our ability to come back from this, and also to move out of the level we are on the dial. So good news, apparently I need to get louder. Good news is that we are seeing a decline in cases. Our 5-day moving average is well down from the peak. We're below our, where we were at the peak of the CU spike, but we're still well above where we need to be. And I'll get into that a little bit when we get to the dial. So one piece of good news that I think is worth trumpeting and really speaks to our community, and that is within the Denver metro area, our 7-day moving average is the lowest of those counties. So that is a really good sign. We've done a really good job addressing behaviors, and just to note here that all of the counties are seeing this significant drop off, and then sort of a stabilization. So the key takeaways from our epidemiological team: case numbers do remain high. Long-term care facility cases are rising, and that's coupled with while case rates are decreasing across most age groups, our case rates amongst those over 75 are increasing. So not great news there. And we are seeing continued persistent disparities. We are implementing a number of programs in the short and long term to try to address the uneven impacts to our minority communities across the county. And then the last bit of good news is that we are seeing hospitalizations decreasing as we get further away from the Thanksgiving holiday, although that is also stabilizing, and I'll get into that in the next couple slides. So we are still at severe risk level red. We've been there since the governor moved us there a couple weeks ago, and our numbers are still well within red. Earlier this week we were at 644.9 cases per 100,000, but I would say we're stabilizing at right now at this 600, in the mid 600s, which is better than we were when we were well above 800 at one point. But it's not getting us really close to moving to orange, which is where we all want to go. So in terms of our positivity rate, 6.8%, again, way better than we were 8% before. And if you look at the map, pretty good in the metro area. We're seeing okay numbers there. So that is a good sign, although again, that's stabilizing there at higher than we wanted. And hospitalizations again, bit of good news there. We're at 9 days of decreasing or stable admissions. That number of days at decreasing or stable admissions has been going up, and that is a great sign. Here's why that number is going down, or another illustration of that number going down. Pretty much since the end of November, we've just seen this big drop off in hospitalizations, which is great news. And sticking with hospitals for a little bit longer, just want to point out that the metrics to move to level purple, which is essentially a stay-at-home level, we're not tripping those yet. They are related to hospital capacity, and right now our physical hospital capacity is great. Again, our hospital staff are definitely seeing issues with staffing and fatigue. So just they are working like crazy to protect us, and luckily our infrastructure is still holding up at this point. So switching away from that, just reminders for everyone. Everyone must wear masks indoors. We've heard reports from various people that a lot of people are wearing face shields instead of masks. That is not an adequate replacement. Masks and face coverings must be worn while indoors. That is the state order. It is required. You do, as a business owner, as a business manager, have the right to bar entrance or remove people who will not or cannot comply with the mask order. There are some caveats there around civil rights, so please make sure that you are following the guidance. But masking is essential if we're going to see our way out of where we are right now in level red. So a couple guidance updates. We at the beginning of this week, the state updated their guidance on a couple issues. And first up, houses of worship and life rights are considered critical businesses, and as such do not have an indoor capacity anymore. And that's a big change because houses of worship weren't allowed to have indoor services for a while there. So or very limited capacity. So now I just want to remind everyone that as critical businesses, they still need to follow all the social distancing guidance, all the masking guidance, reminders that singing is an incredibly good way to transmit the disease. So masking, especially for singers, is very important. And my note there at the bottom, must follow section 3, B, and C. That's from the public health order. And that section really outlines what critical businesses need to do to maintain this ability to have unlimited indoor capacity while still protecting the health and welfare of their customers and their employees. So definitely check that out. And our team is really happy to talk to any house of worship that has questions about that. One detail I do want to bring up: life rights. That does not include birthdays. That does not include quinceañeras. These are graduations are considered a life right, but definitely if you have questions about life rights or houses of worship, get in touch with us and we can dig into that with you. Museums and art studios, they may operate at 25% capacity, not to exceed 25 people per room. This is really focused on the educational value that art studios and museums provide. The state really wants to recognize that this is a way, this is a good thing for the community. Other indoor events are still not permitted. So this is a very narrow exception. And if you have questions, please get in touch with us. We can talk about it today, but it is very narrow. And so let's talk. In terms of bars, so this is an interesting one and bears watching. Bars that don't have food service licenses or are not associated with a food service provider may offer curbside pickup, takeout, and delivery of alcohol. They are not required to sell food at this time. If we move back to orange, if we move out of level red to the point where bars can be open, if they, indoor spaces can be open for food service, then bars that don't have food service would have to go back to being closed. So this is a very interesting one. If you have questions, we can talk about it. We have a number of people on our team who are really good at this. So happy to talk about that. Critical businesses. I mentioned this before. I will say it again. It's really necessary that we pay attention to this. Critical businesses must follow their sector guidance, unless doing so would make it impossible to carry out their critical function. Employees in critical operations must also follow all the guidance. That's masking, social distancing, plexiglass, all that sort of stuff that comes with whatever your sector is. You need to follow those. And we will work with hospitals and first responders on a case-by-case basis if issues come up around that. Now, switching gears again to sick employees and outbreak guidance. I've been putting this in the slides recently, and I want to just keep on hitting it because I think we're still getting a lot of confusion. If you have an individual sick employee, you do not need to shut down. Send that sick employee home. In fact, according to the public health order, you are required to send anyone who has symptoms home. Informing the staff of a possible exposure is very important. One caveat there, you need to protect the privacy of the sick employee. You can't say X person was exposed or is sick. Everybody who had close contact with them needs to report to me. You need to use your knowledge of who that person interacts with to try to identify any close contacts that may have occurred. If you have a sick employee, you need to clean their workspace 24 hours after the last time they worked. There's guidance on the CDC website and on the OSHA website on the level of cleaning that needs to occur. So what is a close contact? A close contact is anyone who was within 6 feet of a person who tested positive for more than 15 minutes in a whole workday or 24-hour period. And this one, a contact of a contact is not a close contact. So in other words, if one of your employees has one of their housemates, household members is sick, is positive for the test, that employee is a close contact. But if that employee came to work and interacted with any of the other employees, those people are not close contact. Outbreak guidance. Outbreak is slightly different. If you have 2 or more employees that test positive in a 2-week period, you may have an outbreak. There are some extenuating circumstances that may make it not an outbreak, but the first step is to close your business. Then contact public health. Our epidemiological team and our business liaison team will work with you to identify next steps and to figure out if there's any way that you can open up quickly. So it's really important that you get in touch with us. It may take us some time to get back to you. We're having lots and lots of outbreaks right now. Lots and lots of sick employees. Our epi teams are working incredibly fast, but they're also, it takes a lot of digging and a lot of communication to work out these outbreaks. So it takes time. With that, I'm pretty much done here. I just want to remind everyone, exposure notification system. I finally updated the link, although I discovered this morning I did not update the link in another presentation I did. So addyourphone.com, that's where you need to go to sign up for the exposure notification system. Reminder that you can also go through the Apple Store or the Play Store on Android phones. It's there. It's a great system, and the more people that sign up for it, the better it will work. If you made it here today, you knew that we moved our sessions to Thursday at 1 p.m. We will keep doing that, and hopefully, we won't need additional sessions anytime soon. But we do have that Friday 11 a.m. to be decided if we have issues, if a change in the order comes up last minute after this session, we would use that session to dig in more into that. There's also the Spanish language session in collaboration with the Latino Chamber. It comes out recorded in advance, but it comes out on Thursday today. So definitely a resource worth checking out. And with that, please do contact us if you have questions and if you have concerns. or complaints, you can call the call center.
Thanks, Jesse. So
Thanks.
what's the name of your cat that's behind you?
That's Roosevelt Eleanor.
Backwards, Roosevelt Eleanor.
Her real name is Roosevelt, but people get upset because she's a girl. She should be
Oh,
Eleanor.
okay. All right,
revise.
so I have some questions for you. I got emailed a bunch of questions beforehand, people saying, make sure you cover this on today's call. So there are Q&A questions as well as some email questions, and I did send you some of them to prepare you.
Yeah.
So the first question is around, have there been any updates for support groups, AA, NA, et cetera? And I pulled it up on the order. It's page 38. On page 38 under the critical businesses, under critical services is in-person group counseling or recovering meetings for substance abuse or behavioral health following distancing of 6 feet or no more for participants, 10 participants. So I put the link for the new order into the chat, and page 38 it's listed under critical businesses. Do you have anything else to add on those AA, NA meetings?
I think you covered it perfectly. They are allowed, they do need to follow the social distancing and masking requirements.
No more than 10 participants according to the rule. And they recommend, if you can do virtual, but in some cases we've heard that you need to have them in person. So they are listed as critical service. Are there guidances for performance venues and studios being used for live streaming or video recording without an audience?
So there is not guidance, and that is because that is not permitted at this time. The number of people involved to make a live streaming recording, unless it's one person in a studio by themselves, that's an indoor event. Once you've started to add more people to that, we had some questions around a theater group that wanted to record a performance where the two participants or two actors would be socially distanced, and there is no room under red for that to occur at this time.
Is that considered an event, or yeah,
it's an indoor event. Yeah.
Okay. Can you give some clarification on the quarantine guidance? This is a two-part question. So we know the CDC revised their quarantine guidance, but at this time, the gold standard is still 14 days quarantine. And the CDPHE in Boulder County have not revised their quarantine guidance beyond the 14 days.
Yes, exactly true. We are still requiring people to do the 14 days.
Now, the second part of that, so a question came up, if I have an employee who has an infected housemate, when can they come back to work if they've continued to test negative?
It doesn't matter how many times they test negative, they need to be out for the full 14 days.
Okay. Somebody heard that a nurse at Boulder Community Health was exposed and they had a negative test and they were able to go back. Is there a different rules for essential workers or nurses under these guidances or quarantine guidances?
So specifically for healthcare workers, because of staff shortages and because they are essentially living in COVID, they do not have to follow the same protocols as the rest of us. There are other very limited exemptions and exceptions, but our healthcare workers, because they're providing a specific service related to COVID, they do not have to follow the same quarantine guidelines. And Lane?
Yeah, I was just going to add that one of the reasons that they don't is they have pretty strict, strong protocols of how they're managing their risks. So obviously people that take care of COVID patients would otherwise be high risk on a daily basis. So to quarantine their staff every time they treated a positive patient would mean that they would never have enough staff. So there are a lot of protocols they have in place to address alternate to the normal quarantine protocols. There still are components where if they have sickness within their own household, now they would still be quarantined, but again, not based on exposures from occupational COVID risks.
Okay. So we have a question asking where to find data on the disparities
I would
for the
check.
health data in Boulder County. I just put the link in the chat for Boulder County data. But there is another question that says on the county site, it says that we have this many cases per 100,000. And the state site, it says we have this many cases per 100,000. The state site is higher.
Yeah.
Now, which one's more accurate?
So accuracy is I think it's obviously important, but I think what you're talking about is how often things get updated. The state website is updated every day. Boulder County Public Health is also updated every day, but we update it probably more slowly than the state's is updated.
So in some cases, especially for the number per 100,000, some of those key metrics, you might want to just go by the state number at some point, because we know that they're drawing directly in from the system. All right, so I put the link for all the stats that the Boulder County collects. That is in the chat. Lane or Jesse, can you talk a little bit about, the buzz is out there a little bit about the 5-star certification program in Mesa County's program, and kind of what the status is on that, and what we should expect to hear about that.
It's still a question mark. We're waiting to hear from the state officially on what they are proposing statewide. The Mesa County program, to date, we haven't seen an evaluation of it that shows its efficacy. So that's a question mark we have. The concept of certification of businesses is something that we've done in many sectors pre-COVID and do support those concepts. In fact, we have worked closely with Corinne in the chamber on this idea, and we've been exploring this even before the announcement of the 5-star and the governor program came out. So it's not that we are opposed to it, but we want to make sure that whatever program goes in place has strong public health foundations, and that we can show that it actually works. In the current statewide status, Jesse showed the picture of the state. You see an almost entire state of red. So this is not the right time to launch variances and reductions, but it is a time to be looking at those things. And so I think we want to continue to explore that and make sure that whatever program is adopted, we feel strongly it's going to work and it's going to support businesses to be successful. I think launching a program while the state is in red that is not proven to work and that may not work could be incredibly detrimental to public health and to businesses, and potentially push us further in the wrong direction. So we want to make sure we take steps that don't do that. And we want to make sure that whatever program goes in place is a good, strong program.
Currently, so the governor solicited feedback on the Mesa, a variation of the Mesa 5-star program through last Friday. Currently, they're taking that feedback and they're assessing it to develop whether or not there is an option for a program. So we don't even know if there is even an option for a program that they want to launch as a pilot. We don't know if that program's even available to counties that are in red. So there is a lot of what ifs even out there. So we don't even know what it looks like. There's nothing out there right now that dictates what this looks like. If it's even available to counties in red, there are a lot more questions than answers. So I don't think any of us have answers as to what a certification program would look like. I know all of us are talking about what we saw last week based on the feedback that we were asked to give. But right now there's, like we said, more questions than answers. But I want to reiterate what Lane was saying, that there's a lot of community partners working together on how we can work on, program community wide to support our businesses, as we move forward. So I know I had many questions come in via email. We had a couple come in via Q&A. I think, we'll see. I think we're supposed to get more answers this week, and then we'll see what the Metro directors and what the governor says and the metro directors say, and we'll continue to work together as a community. All right, anything else you want to add on that? I don't think we have any answers. All right, are you aware of any discussions to allow fitness facilities to adjust occupancy based on the size and not a fixed formula for all gyms? I know we have a lot of really large gyms here in Boulder County. In prior examples, rooms could be drastically different sizes, but right now we have 10,000 square foot facilities limited to 10 people. So
yeah, so I'm not aware of any ongoing conversations with the state from the public health side. It may be that gyms are talking to the state about that, but I don't know, Lane or Corinne, do you know any more about that?
No, I haven't heard of any other changes. I think the only other possibility is to divide those spaces so that they can create multiple rooms. That gives that ability, but unfortunately, one large space is still limited based on the current state order.
And I've worked with a couple gyms to get creative because it's still nice out to say, can you put 10 people outside while you have 10 people inside? Can you find a non-penetrable material to divide your space, and work with Boulder County Public Health on a dividable material that goes from floor to ceiling to divide your space into multiple rooms? There are some very creative solutions happening throughout Boulder County to try to keep some of our gyms open and accommodate some of this. And the question is also, multiple pools only allowing, if you have more than one pool, still only allowing more than 10 people. Your presentation just went in. I think it's the same answer on that one too. Can you explain why face shields are not a replacement for face masks?
Yeah, 1 second. I'm gonna stop sharing, or I'll share this again, just so we're in the right place. Just want to. So the reason that a face mask is not, or I'm sorry, a face shield is not appropriate, is that aerosolized particles can still pass out the sides of a face shield or the bottom of a face shield. A mask, even a mask that's not perfectly worn, will limit more of those particles. So that's really the science behind it at this point.
A face shield is a protection for the person wearing it. So it's intended to protect your eyes and mucous membranes. And it's usually from physical hazards, not so much from biological and aerosolized or droplet particles. It's more of a physical hazard protection. But it doesn't, as Jesse said, do anything to protect people from the person who's wearing it. So all the droplets that are coming out of that person's mouth can still easily move into the airspace.
All right, I got a question. When can I get a vaccine?
Depends on who you are, and we're not sure of an exact timeline, but we do expect to see our hospitals, like our healthcare workers, hopefully get vaccine this month. And then hopefully we'll start to see some of the highest risk. If you watch the governor's press conference, you can go and see the governor. They've created the tiering.
I sent it out today in today's email. I sent out the tiering structure as well as the frequently asked questions on the vaccine, the state website on the vaccines, all of the information on the governor's vaccine plan in today's email.
That's great. So that gives you the ordering. There's still question marks of when we will actually see those vaccines arrive, but the rough time frames for the general public are we hope to start seeing vaccinations in late spring, early summer is kind of the rough timeline. And it will require 2 doses, typically depending on which provider you get your vaccine from, and you will need to stay with whatever vaccine you get. So you can't switch between the different providers. And then there's a period before you get your second vaccine, and then you are fully immunized within 2 weeks of that second vaccine. So,
and there are certain age groups that haven't been tested on, correct, that we'll have to wait for official approval before those age groups are even allowed.
Correct. Yeah, I don't think there's been anything for pregnant women and for children, I think under 10 or 12. So those are going to be, or maybe actually 18. So there's going to be some groups that right now are not going to be part of that until there's further approvals for those vaccines.
So when you see those news stories that say Boulder County is getting its first round of vaccines December 12th, those are most likely going to be for, that first tier, which are the healthcare workers and the staff, that first tier that's in the governor's plan.
Yeah.
So again, go to the link, the frequently asked question, the tier plan. And then if you send me an email that says, when can I get my vaccine? I probably will send you to the governor's website.
Yeah. And by the time we're able to vaccinate the general public, you will be able to get it at your healthcare provider or Walgreens so again, it won't be a matter of it's a hidden place or you won't know about it. There'll be a lot of advertising to share that. We very much want to make sure people are aware when it's available and that they go get it. But yeah, we will get our first shipment of vaccine within 24 hours of the approval of those vaccines. So and we're hoping that's within the next week or so.
Okay. Two more questions about data, and then I'm going to move on to some of the changes that were made this week. So first question about data, have we seen this Thanksgiving spike yet?
No, we have not seen the Thanksgiving spike yet, and we're expecting, the timeline for that will likely be in the next couple days. And how the spike comes, we won't know. Really, if we make it through the Thanksgiving holiday without a spike, that'll be down to all of us doing what we could, and that'll be a reason for a little bit of celebration by yourself, not in any gatherings, but just celebration, maybe a woohoo at your computer. But it'll be the next couple days that we see any spike.
Okay. So someone did go to the website and saw the disparities in the cases, especially among the cases in people of color in Boulder County. Has there been any discussion about ways to address the imbalances in the percentages of cases?
Yes, absolutely. There have been a number of programs. We're working with our cultural broker program to try to get the word out to our Latinx community. We're working with specific neighborhoods and specific communities that have seen spikes in cases to try to, provide information, provide, some comfort that we are aware and we're trying to provide services. So, I think we're always looking for new ideas. I am not a public health employee normally. I will just say that public health works very hard at this. As someone from the outside looking in, public health is aware and is working very hard to address those disparities.
There's a couple of communications campaigns happening as well through public health and through a collaboration between the county and the chambers. A couple of them will be Spanish speaking as well. So we're trying to get at the heart and go through the communities through influencers as well to try to give the message from people within the communities to tell the message as well. So I think we're trying to do everything we can to get the message out there, to show that it's safe to get tested, to talk about rights as employees. We're also sending out letters as this is your rights as an employee. These are quarantine. These are some resources, things like that.
We've also reallocated staff and are looking to continue to bring on additional staff to work on disparity issues. It's also part of the county's economic recovery focus to make sure that equity and disparities are an important lens in all the activities for recovery. So there is quite a bit of focus. That being said, the numbers, we really want to see those numbers change.
All right, let's move on to the order changes that happened this week. Two main ones were the bar one was a little, that one's over there. I don't have any questions around that. So start with the houses of worship. With the new categorization of houses of worship as essential businesses, if we were to move to purple, would churches still be able to stay open?
So I saw that question and I looked up the order, and I think two things, two ways to answer that question. One, houses of worship are no longer listed under level purple, which means that they are considered critical businesses. However, because of this very recent change, I would expect if any communities move to level purple, there will be specific attention paid to that when we move, if and when we move. And I really do mean if. There, there's no sign that we're moving there, but if it were to happen, I think there would be a lot of attention paid to how that impacts specific sectors.
And you mentioned a little bit, so it's very clear in the order that within the houses of worship, you need to have groups socially distanced. Those are groups of families,
Yep.
6 feet apart from each other.
Families and households, and everybody needs to be wearing masks, remain wearing masks, and yeah.
So then you also, go ahead, Lane, sorry.
To say that important piece is, it isn't unlimited occupancy. It just isn't a set cap. So it's really going to be based on your ability to socially distance people inside. But it does remove just a flat number that says you can never exceed, 50 or 100 or 75. So that's an important piece. And just because you can do things doesn't necessarily mean that you should. So certainly if we were seeing things get worse and go to a level purple, we're still going to be telling houses of worship to do virtual ceremonies and not meet in person, because the risk will be dramatically higher than where we're at right now. We've seen hopefully the start of a recovery towards, getting to a better stage. But it's just an important piece that there's nothing that says houses of worship can't transmit disease. In fact, there's been a lot of outbreaks across the country linked back to services. So it just gets into more legal court battles of what starts to violate constitutional rights and not. And so again, doesn't mean that there won't still be significant transmission if we were in a purple phase.
Well, just like manufacturing, since a lot of manufacturers, like our aerospace manufacturers and so forth, have been critical businesses since the beginning. It says in there, you try to follow the orders as closely as possible. And so you try to do as much as you can to restrict capacity. And a lot of our manufacturers are operating at bare bones to try to protect their employees and keep them socially distanced and make sure that they don't spread the disease, because they have seen some outbreaks when they aren't following the rules and orders as closely as possible. So for weddings held at a personal residence, what is the limit?
Group gatherings are not permitted. Life rights. Okay, fair enough.
The life right.
Yeah. So there is. It would be the capacity of the room. I would use the social distancing calculator, to be honest, in that situation. I also would really encourage you to limit attendance to that. Again, I think this goes right to what Lane said. Just because it's a life right doesn't mean you're protected from the virus.
And I think the idea of if you can do that outdoors versus indoors, those are ways to reduce risk. Again, the timing of doing it indoors in the winter, you're just adding a lot of risk. So that being said, that doesn't mean it is prohibited. So it's just a matter of really trying to think through and reduce risks where you can.
Okay, so let's go to the museum clarification. Jesse, you also know the email that came in about this. So if you're not technically a museum, but you create education services for youth, like a painting class or an art class, are you able to operate as well?
Yeah, under a couple different ways of thinking about it. One, you have that the order does include art studios in that educational thing, but it has to be for educational purposes. So a youth painting education class is a perfect example. There are restrictions under the education part, learning pods and all of that explain how to do that. I'm not an expert in that. If you have questions about that, you can reach out to public health about it and we can give you more details. But it is possible to have a painting class for children. Again, sort of going back to what Lane said about thinking about your levels of risk. If it's possible to do it outside, that's going to be much better for everyone in terms of the chances of transmission.
And the pods there's quite a few restrictions on those. So it's important for people to really take the time to look at that. There are limitations based on the age of the children that will be in the pods of how many kids can be there. I think they must be at least, first grade, 6-year-olds and up. So it is not for very small children. Again, those need to focus on childcare and being licensed childcare for the really young kids. So it is important for folks to look, and there's a limitation on a single pod for the facility. So you can't set up, a pod per room. So there's a lot of restrictions on the pods too.
Now, do they fit under the museum qualification, Jesse?
I would say that they do not fit under the museum qualification, because the museum qualification is really about people going to a place and observing. There's not touching, there's not interaction going on. It's going to a museum, seeing an educational thing, and then leaving. I think that an art education class falls under the education guidance.
Yeah, because camps themselves, I think, are now pushed to being outdoors.
Yep.
So again, I know everyone wants to find which group allows me to do what I want, but the more important thing is, what are you actually doing and where does that fall, instead of trying to put yourself into another group. I know it's the challenge, and sometimes doesn't feel there's consistencies across groups, but
and I have to give a kudos out to one of our local museums. They could reopen under this new order, and they've chosen, because of community spread and the risks, have chosen to wait because they're worried. They know that it's hard to keep kids distanced and do some of that. And so they're taking a hit, but they're going to, to put the community health, first and foremost, and wait to just help prevent some further community spread. So, they weighed the risk on the reopening on that part. All right, so I have some more clarification questions on exposure. Can you explain under what circumstances a contact of a contact may necessitate quarantine? What if that person now becomes positive? Does the contact of that contact now need to quarantine?
Not necessarily. It depends on the situation. So let's just say this way. If someone tests positive, you need to look back 48 hours before they tested positive, the time they tested positive, to see who their close contacts were. So in other words, if you had a family member who was positive, or if you had an employee who had a positive family member, they stayed home for their 14 days because they were a close contact of that person, it's unlikely, even if they tested positive during that 14-day period, it's unlikely that you would have any close contacts in your office or in your work setting. There are situations where someone, someone who is a close contact of someone who's positive comes to work, then they realize they're a close contact, they leave. Anybody, and then they test positive. Anybody who was within 6 feet for 15 minutes or more for the 48 hours before they tested positive would be then a close contact.
Every case is then dealt with, so there is no secondary level. So again, somebody who tests positive, now you're looking at their close contacts, but not anybody that those contacts contacted. So again, someone who's quarantined that becomes positive, now you would look at, did they have close contacts during their quarantine that now are high risk? So again, it doesn't matter about when they were initially considered a close contact, they can't instantly become ill and then also have X many contacts. So it doesn't transmit that fast. So you're really looking at each case and their level of first level of contacts, and there's no more iterations after that.
A question about cleaning sick employee workspace. It says we do not need to close for one employee, but also to wait 24 hours before cleaning. What if that workspace is the same for all employees?
I saw that question. It's a really good question. I think I want to talk to some of our public health experts, Lane, unless you have an answer. I mean, I think if it's possible that they, this is one of those things where, as part of transitioning out of normal everyday business to COVID business world, we need to try to create spaces where people are working in one space. That can obviously always work, but that's the goal. Yeah, I don't know, Lane, if you have anything to add to that.
Yeah, I mean, I think they're just looking at, if you can leave the space dormant for 24 hours, first off, droplets are now settled, and the virus doesn't live with outside of a host. So most of the virus is going to be dead, anyway. But that's not always a reality. So I think the idea of cleaning that space sooner, but then potentially coming back again to clean it, it's further reducing the risk is the goal there, is to try to leave that space and then come back and clean it. So you're not putting somebody right into a space right after somebody sick was there. That being said, certainly if they're in a respirator and they're further protected, now you've really minimized the person who's cleaning the area's risk of getting anything.
In some of these, I mean, this happened to be a dance studio, so it's hard to, it's one room. I mean, it's hard to siphon off people into different spaces. But yeah, you're not putting the cleaner at risk, I think, as part of that 24-hour waiting period. So that's part of it. All right, more clarification questions. If live stream performances are not allowed, is my gym streaming a fitness class not allowed?
That is allowed. So the live streaming of performances, the question was for a cultural event, for a music performance or something like that. And often if there's more than one person in the room, but what you're doing usually with your fitness class is they're filming a permitted activity, and so
with a mask,
with 6 feet of social distancing, all that kind of stuff. So really, it's, if you're filming an activity that's permitted, that's one thing. The other thing is you're planning a gathering, essentially, if you're going to have more than a couple people in there, just to film an activity. I recognize that this is splitting hairs in a lot of cases, but that's the way the guidance is written. And I do think that there's something to be said for, if a class is happening under a permitted situation and it's following all the guidance, recording it is safe, or safer. I guess safe is a bit much.
Okay. Follow up on the exposure question. So we actually, they actually spelled it out. So if you were in close contact to person A and the next day person A found out their housemate is positive, is your interaction with person A considered a risky exposure if person A has not yet tested positive?
No.
What if person A tests positive?
Then if person A tests positive, then you are a close contact with person A and you need to quarantine.
And again, that would be looking at when they test positive. So,
and if you had been in exposure of more than 15 minutes within 6 feet, within 48 hours and then testing positive.
Yep.
So the fact that one person was around somebody sick, they leave and go hang around with other people, which they shouldn't be doing anyway. They didn't get sick immediately. They are at risk of becoming sick. And when they do become sick, now you would look at who they've been around within that time period. So, it's certainly not impossible, but it's unlikely given what they just presented. So you're going to wait until that person becomes sick to now look at who are their high risk exposures in the last 48 hours.
Okay, and then if someone has exposure to someone who has symptoms, but has not necessarily tested positive yet, should that person quarantine?
So no, that person who has symptoms should be quarantining.
What about the person who's a contact of the person who has symptoms?
Not yet.
The,
Not
the-
until there's a positive test.
yeah, the person who's sick should be isolating, but they should get tested to find out. So if they never get tested just because they don't want to know, that other person is a high risk exposure of somebody who's sick, but without knowing that it's COVID, they're not forced under the law to be under quarantine. But
Because that person has symptoms, it's a good time to get tested, because with symptoms, it's a lot, it's more likely that you're going to get an accurate test.
well, they're contagious for whatever they have. And so the person who is around them, especially within 6 feet, not wearing a mask, all that sort of stuff, they're a high risk exposure for whatever respiratory disease they have. Again, they aren't strictly required to be under quarantine. And this is a concern where people say, well, if I just don't get tested, we don't ever have to deal with COVID. And that's how we get to where we were 800 plus cases and potentially looking at businesses closing down. So when you're sick, you need to not work. Businesses need to send their sick people home, regardless of whether they have a COVID positive test or not. And then we really want people to get tested so we can isolate disease and keep it away from the rest of the community.
And then that person who was, in close contact with someone with symptoms should monitor their symptoms. And if they start having symptoms, then you get tested and definitely take yourself out of the workplace as well.
There's a lot of people who get COVID and don't show symptoms, but are spreading the virus. So that's the other reason why when you're around someone who's sick, that's a concern. So we want to minimize all of those kind of exposures. So.
All right. So clarification, can you define a gathering? Is it okay to go walk outside with someone not from your household within 6 feet if you keep 6 feet apart from that person?
Yeah, so this is something I will admit I got this wrong a couple weeks ago. I was being negative and I said you should not be gathering outside of the household, but if you can go outside for a walk with a friend, you can go outside for a walk with a friend. You need to stay 6 feet apart. I really encourage you to wear a mask regardless, because the chances that you're actually staying 6 feet apart are pretty slim. So be very careful if you do it, but it is permitted.
In a multi-firm building, if 2 employees and another from 2 different firms test positive, do you have to shut down the building? Or is it considered an outbreak?
This is why we have epidemiological experts and why we have the business liaison team. Yeah. I can't speak to the specific situation, and maybe this is just a hypothetical, but it's unlikely that we would shut the whole building down. But if you all worked in a large co-working space and it was a bunch of firms, then maybe we would. Or if you shared facilities, sometimes it's a very case by case basis. We would be in touch with the building manager and each of the businesses involved to try to sort this out.
The goal is to try to find out where transmission is happening. So each person that's sick, that is the goal, to investigate that. And so if at work those 2 people interacted and have a risk of exposing each other, and that's why they're both sick, then that's an outbreak. If they have no contact and there's no way each got sick from one or the other, then they just happen to both have gotten sick and they both happen to work at the same location. So that's not an outbreak.
All right. I'm going to ask one more question and then we're going to get to restaurants. I have 3 questions about restaurants.
Great.
Can you host a work meeting of 10 people outside, socially distanced with masks?
I would say no. And I'll tell you why. I think what at that point you are having a social gathering. if you need to have a business meeting and you need to have it in person and you need to have 10 people, yeah, that's a safer way to do it than to have it inside. But the safest way to do it is virtually. What I'm getting at is, during the summer, people in my office had someone was leaving to go to another job, so they all got together in a park. They were socially distanced. They were wearing masks. It was a social gathering to say goodbye to a coworker, and I get it, and it is possible, but is it a good idea? It's not a great idea. Just from a transmission standpoint, is it a great idea from a social norms? Maybe, but I think avoiding those situations is a good idea.
We should all make that question. Do you need to have this meeting? Do these people need to gather? There are certain times when in-person arbitrations, there are things that need to happen in person that online doesn't work. There are certain situations where an online doesn't work, but does this have to happen in person is the first question you're asking people to ask. All right, I know you have to leave, Jesse, so really quick, we got some emails about rumors in the restaurant industry that there may be further restrictions on outdoor dining and convening of groups on the outdoor dining. Are those rumors correct? Are you going to put any more restrictions on outdoor dining at this time?
I am not aware of any discussions within Boulder County Public Health about additional restrictions on restaurants. I don't know.
Right now, you can only eat with people from your own household outdoors, distance from other tables, correct?
Absolutely, yes.
Yeah, we've not proposed any restrictions, and I have not heard anything from the state. So, if they've heard something from the state, that's something we have not heard.
Okay. Next question was it's a little bit about how can a Life Right operate, but then we can't have indoor dining. And Lane, you talked a little bit about how this is a little bit around some of the constitutional ramifications of limiting some of the religious ceremonies.
Yeah,
So,
it's not based on risk. So again, I think that's a challenge for folks if they look at, well, how come this group can do it and this group can't? And it gets back to more the legality and court battles. So it isn't. None of those life rights are exempt from spreading disease. In fact, if they take place when there's high levels of transmission in the community, there's high level likelihood that they will spread disease at those events. So, but yeah, it's not based on life rights are less risky.
And I think that's absolutely right. I was going to say basically that again. So.
And then we have a question. And it says, I know it's not your department, but some of our local restaurants, and not just restaurants, gyms, personal services, retailers are barely staying above water, barely surviving, and wondering if there's any support on the horizon. And I just wanted to say that there was a special session of the state legislature that did designate some additional funding for certain industries. The money will be filtered through the counties. And that money will be in the new year. And once we have more information on that, we will let you know how that money will be available. There is some progress being made on the national front on a potential stimulus package. Boulder County has made available some, this is limited, some cleaning supplies, PPE, and for restaurants, some additional to go, resources. That closes. They're probably gonna, I sent it out in today's email, apply for it this week. We'll probably run out this week. Anything you see like that, take advantage of it. This is how we're doing it. If you're in the city of Boulder, I know the city of Boulder signed on with NOSH for delivery services, and they're offering free delivery through the end of the year, for both the restaurant as well as the consumer to try to push that. There was the SOS program for retailers. I think we're trying to do as many things as we can. The Shop Local campaign, Strongmont, Longmont's 3 times program. where you think about 3 times a week, you can do something local, spread the word about on social media, get curbside, shop a local retailer, do some, get your hair cut, do something local. If we can all spread those words and do something, we can all make a difference. But I know that's not the answer probably looking for, but we're trying to come up with as many things as we can.
There's also
And
an effort to waive the license fees for restaurants and maybe a few other limited categories.
and then there's the sales tax. In the session, there was also a sales tax relief bill as well. So, if you haven't heard about that, there will be a sales tax relief that's coming from the state. So there are these little efforts that are trying to help, but we understand this is tough. So everything we can. Sorry, Jesse. Thank you for.
No, thank you.
Thank you.
Thank you. Thanks, Jesse.
Bye, everybody.
It's just me now. So at this point, I'm going to thank everybody for joining us. If we didn't get your I know we didn't answer 2 of the questions. So it's just me, so I'm not going to answer them, but if I will take those 2 questions down. At this time, I don't think there is anything that says that the order will be lifted on the December 18th. So if you've heard that, that is not currently the case. And we will get your questions answered if they were not answered, and we'll see you next week. We do not have a session on Friday. We'll see you next week, and thank you to everybody that attended. And in the meantime, if you have questions, do not hesitate to email me or the County Health Department. We'll see you again. I think we're on number 161 next week, so we'll keep these going. Bye.